Hi and hello everyone, welcome to the Nursing Virus YouTube channel. This is me Loganathan and this video regarding the NORCET 2022 Shift 1 examination, the memory based question and answer. So this is a completely memory based question and answer. So some answers may be differ and the questions also formulated based on the memory only. So if there is any corrections, you can write it in the comment box. And so far, if you are not subscribed my channel, don't forget to subscribe and click the bell icon. So here we are going to see more than 100 questions on this video. So the first question, so the low birth weight baby is considered as, so less than 2.5 kg is the ideal body weight, will be considered as low birth weight. The next one, so identify the given image. So that is a pelvis image they were given, and this pelvis will be considered as niggle pelvis. So that is the given image. The next one, question number 4, vaccine kept in the freezer compartment of the refrigerator is, they given that 4 answers. So among that, the measles is the correct one. So apart from the measles, the other 3 more vaccines also will be kept in the freezer's compartment. That is a measles, mumps and rubella. That is a MMR vaccine. And the next question. So vitamin A deficiency caused the night blindness. That is due to vitamin A deficiency. So next question. So what is the primary prevention for the cervical cancer? So this is one of the most repeated question in the AIIMS and as well in the JIPMER. That is a HPV vaccine. That is a first primary prevention level. So this vaccine can be given for the females, that is above 45 plus age group. Commonly it can be administered. The next one, 6th question, that is related to the family planning method. That is, which IUCD need to be replaced only after 10 years of period. So this is one of the question already discussed in the JIPMER question paper in Nursing Virus channel. So here the copper T380A will be replaced so after 12 years of period. So that is a maximum year we can trust this method of family planning. So that answer C is the correct one. So next one, so World Patient Safety Day celebrated on every year. That is in the every year September 17 will be considered as the Patient Safety Day. So next one. So according to that anemia Mukat Bharat for that prevent 8th question. So according to that anemia Mukat Bharat for that pregnant woman, the iron and that folic acid requirement for the pregnant women is, that is among the given answer, that is 60 mg iron and 50 microgram folic acid. So but this ratio is given according to the AIIMS regulations for the pregnant woman. So next one of that surgical blade number they asked. So they given that 23 surgical blade number and they asked what is the size. So the surgical blade number 23 is the correct answer among the given option. So next one, again that image based question. So identify the given image. So this question also were discussed under the instrument based question and answer. So we all know that is a fetoscope, or it is known as Pinerath fetal stethoscope. So there is a given image to identify the fetal heart rate during pregnancy time. So next question. So using that rule of 9, estimated burn size in the adult having that burns injury to the total area of backside and the right arm is known, the how much percentage need to be considered. So that total backside will be always considered as the 9 plus 9, that is a backside thoracic area 9 and backside 9%. So totally 18. And another one, the right side arm, it is totally considered as 9%. So it will be totally 27%. So this question also were discussed in the nursing virus channel. So the next question number 12. The hormone responsible for the menstrual cycle is, that is a progesterone. And 13th question, the test need to be performed when the patient in the heparin therapy. So commonly the activated partial thromboblastin time, that is a APTT test, can be performed. So the next question, what dose of adrenaline is being used in the pediatrics? That is a 0.1 ml every body kg of the patients. That is a 1:1 lakh ratio. The solution can be diluted. So next one, again the image based question. So identify the given image below. So here the given image is the Joel's thyroid retractor. So it can be used during the thyroidectomy procedure. So next one, so the Wernicke encephalopathy will be caused by due to which vitamin deficiency? That is a lack of thiamine. So the person will use to get the Wernicke encephalopathy, or it is called as B1. It is very common in the alcoholic patient. So to prevent that brain damage, we'll use to administer the thiamine. So the next one, so procedure to measure the nasogastric tube in the adult. So the measurement they asked from where to where we need to measure before making the injection. That is a measurement of the distance from the tip of the nose to the earlobe and to the xiphoid process. So this is the correct measurement to take before injecting the nasogastric tube to the adult patient. So next one, the risk associated with the intravenous bolus potassium chloride is, it's actually when you are administering bolus amount of the large amount of potassium to the patient. So the person will use to get the hyperkalemia, and as well the cardiac arrest they'll use to get. So that is the reason we should not give the bolus until it is necessary. So next one, 19th question. So the common method used by the Anganwadi workers at the center to monitor the growth rate or to assess the malnutrition of the child. So commonly the malnutrition assessed by that every Anganwadi workers by making that weight according to their age group. Thereby they will maintain the growth chart. So next question. So what is the best site for the DPT immunization? That is a diphtheria, pertussis and tetanus. That is a vastus lateralis is the best site to give the DPT immunization for the children's. So the next question. The National Institute of Nutritional Center located at the Hyderabad. The next question. So after thyroidectomy, the patient will be on the post-operative period, the person having the carpal pedal spasm, and this sign will be mainly indicated for which electrolyte imbalance. So the carpal pedal spasm, so it is very common after the thyroidectomy procedure. So that hypocalcemia were mainly indicating the carpal pedal spasm on the client. So the next question. At what age the gender identity will be formed? So at the age of 3 years, the gender identity can be mainly formed from the both male and female. So it will be started in some cases 18 months to 24 months. The next one, the contraindication of the liver biopsy. So the liver biopsy will not be performed on when the client is having any kind of hemorrhage or even the bleeding cases. So on those cases, they will not perform the liver biopsy. So next question. The needle stick injury at the hospital. So what can be done by the nurse immediately? So we need to wash the wound in the running water to avoid the further infection. So next one. So and what picture is shown on the back of the 2000 rupees currency note? So the Mangalyaan, that is India's first interplanetary space mission. so which the image were represented in the 2000 rupees currency note. So the next one, so identify the non-absorbable suture material. So they given that 4 answers, and among that they kept polypropylene as a non-absorbable suture material. So the next one, again the image based question. So they given that vaginal examination picture, and they asked to identify what kind of infection is this one. That is that chlamydia vaginatis is the right answer on the given image. So the next question. So according to the biomedical waste management, the needle should be discarded in the which color bin? So always the needle will be placed in the white color bin according to the biomedical waste management. So white color is the correct one. So here I have attached the color coding, and the instruments will be discarded. So according to the WHO, so this is the manual they are following. The next one, the heat sensitive vaccine is called as, that is that 2 vaccines will be heat sensitive. So that is, one is according to that examination, that TT is the correct answer. Another one also we have the heat sensitive one, that is that adsorbed diphtheria vaccine also is one of the heat sensitive. So the next question. So identify the type of problem in the given pedigree chart. So according to the given image, so the disorder can be transmitted into the next generation, that is autosomal domain disorder. So the next one, identify the given image below. They given that Foley's catheter, and they asked to identify the image. So it is easily can be identified, that is a double lumen. So here you can see there is a double lumen. So the edge you can see. So it is a Foley's catheter, commonly to drain the urine, will utilize. So the next question. So identify the given image in that X-ray. So they were shown that diaphragmatic hernia image on the given picture. Here you can see the diaphragmatic area. The person is having the protrusion of the organ. So that is indicate for the diaphragmatic hernia. So the next question. So again that image based question, they asked to identify one of the infectious condition, that is a tinea corporis. That is the correct answer. The next one, the problems occur due to that vitamin D deficiency, that is rickets. So next one, so one of that drug related question, that is, so which antihypertensive drug should be given during that lactating mother except? So they asked one of the except drug. So first we need to know what all the drugs can be administered for the pregnant mother. That is that methyl dopa, labetalol, and hydralane can be administered. So during that hypertensive period in the pregnancy time. So apart from this answer, they given that another drug, that is that losartan potassium. So this drug will be the correct answer for the given question. So next one, so what is the most common site for the bone marrow aspiration in the children? That is the posterior iliac crest is that appropriate spot for doing an bone marrow aspiration for the children's. So the next one, so the normal urine output on the adult per day. So the normal urine output will be considered as 800 to 2000 milliliters per day. So it is the normal range of an adult. So the next one, so the apical pulse located in the child. The answer is the 4th intercostal space at the left mid-clavicular line. So the next question, that is the patient to receive 20 micrograms once daily. So the medication is available in the dose of 300 microgram per 15 ml of the ampule. So how much the nurse should be administered? So here the given formula is, so we know that the needed amount of drug that can be calculated by the drug order and total amount in the ampule divided by the dose in the ampule. So that order drug is 20 microgram, and the total amount in the ampule is 50 ml. So the total dose in the ampule is 30. So when you're crossing this one, so we'll get that answer like this can be crossed by 2, and this the 1, and this the, when you're crossing 20, we'll get 10 answer. The 10 microgram can be taken for 10 ml can be taken from the ampule to administer to the patient. So next question. The axillary dissection during the breast cancer surgery can cause the condition known as the winged scapula. So it occurs due to that which nerve damage. So this winged scapula is very common after that breast cancer surgery. So that is a damage of due to that long thoracic nerve, and as well the serratus anterior muscle weakness. The person will use to get the winged scapula. So the next question. The monoamino oxalate inhibitors with tyramine containing food items can be caused hypertensive crisis. So always whenever you are administering the antidepressant drugs, we'll use to avoid the tyramine food items. So next question. The treadmill electrocardiogram stress test is widely used to screen for the obstructive coronary artery disease, that is a CAD. On this condition, what is that ECG changes can be seen in the result. So always the ST segment changes can be seen. It's either it may be in the depression form or in the elevated form. So which is mainly indicating for the CAD in the ECG. So next one. The endotracheal tube formula for the child uncuffed size. So the uncuffed size is equal to 4 plus age divided by 4 is the correct formula for the uncuffed ET tube. So in case of cuffed one, that is at 3.5 plus age divided by 4 will be considered as a cuffed one. So the 46, on the blood transfusion procedure, if the nurse identify any reaction, what nerves need to be do according to the priority. So we need to stop the blood transfusion is the appropriate answer for this procedure. So the next question, the CPR ratio for the infant, that is a 3:1, the compression is to ventilation. So next one, the severe dehydration in the pediatrics with the symptoms of that shrunken fontanelles will be that major sign in case of infant. So next one, question related to the psychiatric, that is the delusion involves believing in special and sometimes secret connection or relationship with someone or something important. So what kind of delusion they were asked? So the correct answer is the delusion of grandiosity. So next question. So identify the given image. So they given this image and they asked to identify the name for this instrument. So the correct answer is Altrician harmonic scalpel is the correct option. And the next question about the GK, that is which river flowed the Punjab except. So actually the Punjab is very famous for the 5 rivers that flow in the city of Punjab. There is the Indus, Jhelum, Ravi, Beas and Yamuna. Out of this, one wrong answer they given and they asked the except answer. So next question. So which of the following is the coal dust induced occupational disease? So the correct answer is pneumoconiosis, that is the anthraposis or the black lung disease. So the next one, the central body of the Bank of India is located in, or it is called as the Reserve Bank of India, that is the RBI. The next one, the head tilt chin lift method is called as jaw thrust. It is very common to clear the airway during that CPR procedure can be performed. So 55. The client with a peritonitis, perforation, laparotomy procedure, the physician need to use the central line to check which of the following things, that is a central venous pressure, can be maintained or can be monitored with that central line. The next one, the client with that peripheral cannula shows that redness, edema, and warm skin. So this sign may be indicated with the phyllitis. So if it is these things, that edema or that redness or that a clot is getting moved, that is a thrombophlebitis will be considered. So next one. So what kind of performance-based scale used to assess the level of importance and everyday motor function in the patient with a stroke? The scoring system will be considered as, so that the correct option is motor assessment scale, that is the MAS in short form, it will be called. So next one, so the correct option, 58 question, which of the following will be increase the absorption of iron? So they ask the except one. So they given the options like a citrus, amla. Among that, the curd will not make that increased level of absorption. So next one, the anorexia nervosa, which problem will be present except, that is a menorrhagia will not be present in case of anorexia nervosa. So question number 60. So in case of any fire in the hospital or in the ward, the priority management by the nurse is immediately we need to cut down the oxygen supply. So because it will used to easily catch the fire and will make the over threat to the patients. The next one, 61. The Bob's patient need to get the adequate fluid to prevent the risk of hypovolemia or hypovolemic shock. So either the patient need to get the IV fluid or there is a TPN. So next one, the regular insulin will use to get peak time effect. That is a normal regular insulin will use to get peak time within 2 to 4 hours. So in the question paper, they given one timing, for example, 9:30. If you are administering that insulin, at what time the patient will use to get the peak level of insulin effect. So based on this hours, we can calculate the right timing. That is, if it is 9:30 mean 10:30 and 11:30 will be the peak time we'll use to get started. So next question. So what does the skin look like with the Addison's disease? So Addison's disease patient always will used to have the hyperpigmentation over the face and as well all over the body. So next one, rat flea can cause. So the rat flea will commonly cause the problem like rickettsia type. So this is the common disorder will be caused. So next one, 65. The multiple sclerosis condition, which problem is commonly seen? There is a CNS demyelination is a major problem can be seen with the multiple sclerosis. The next one, inactivated whole virus vaccine in the COVID. There is a Covaxin, so which is mainly produced by the India. The next one, related to the breastfeeding. The good attachment sign or latching of the baby on the mother during the breastfeeding, except. So commonly we have that 4 common good sign for making that good breastfeeding. That is, the baby's mouth is wide and open, baby chin touches the baby breast, and baby lower the lip in the curled outward. So this option they were changed. That is usually that lower portion of the areola is not visible. So these two options they merged and they turned into the opposite. So this will not be seen in the good attachment sign. So next one, 68. The surgical patients checklist. So the accept answer they asked. So here according to the WHO, the patient safety checklist for the surgery procedure they asked. So commonly that blood group of the patient. So that will be the correct answer for that question. And 69. So another one question from related to the myasthenia gravis. So this is the neurotransmitter impulses will used to get dropped down. That is the kind of an related answer for this question. And 17th question, which fish eat the larva of mosquito that cause the malaria? That is the fish like a Cambusia is the fish will eat the malarial mosquitoes. So next one, on the tension pneumothorax, so what will be the immediate treatment? The immediate needle decompression by the inserting the large bore needle into the second intercostal phase in the mid-clavicular line. So will be the correct answer in case of tension pneumothorax. So next one, the normal heartbeat for the adult, that is a 60 to 80 beats per minute will be considered as normal. The next one, in eating disorder, the patient with anorexia nervosa given the diet plan of the food containing high fibers, there is a whole grain food items commonly will be given. So next one, the newborn baby passes the meconium within how many hours of born? That is within 24 to 48 hours, the meconium will be passed in the normal newborn. It will not get delayed beyond this. And the next one, the endemic disorder that occurs every 4 years interval is known as cyclic trend. So the next question, the screening of mental disorders such as depression at the community level during a home visit is the example of which level prevention? So always the screening process will goes under the secondary level. So the secondary level prevention is the correct option. So next one, during the grand mal seizure, what is that immediate action need to be done? So here the grand mal seizure will become more vigorous. So the patient need to be transmitted into the safest place. So next one, so on the 9th month, that means 36th week of gestation, the normal amount of amniotic fluid is 1000 ml. So if it is goes over this, it will be considered as over amniotic fluid. So the baby will start to get floated in the placenta. So next question, that disinfectant used in the COVID patient to clean the linens, that is a hydrochloride solution commonly used to clean the linens of the COVID-19 patients. So next one, related to the aptitude. So here the find the missing number, that is 1, 1, 2, 3, 5, 8 and 13. So what will be the next number? Just we can add this number. So we'll get the first one. So and adding the next one, that is 1 plus 2, that is a 3, and 2 plus 3 will be get 5, and 3 plus 5 will get the 8, and 5 plus 8 will get the 13, and 8 plus 13 will get the 21. So the 21 is the correct option. So the next question. So what is the main reason of child mortality at the worldwide? So that is a pneumonia. So if they suppose if they are asked in that India wide, that is a diarrhea and prematurity will be the reason. And 82, the reason for providing that lactose syrup in the child with that with the client with the liver cirrhosis, that is mainly to prevent the complication of liver disease, that is a hepatic encephalopathy. So 83, in emergency due to school bus accident, so there are too many children at the emergency, as a nurse will provide the priority care to which of the following condition? So they given the 4 children's condition and they asked which among that will give the priority based on the triage. So the patient with that leakage of clear fluid in the ear and the nose will be given the first most priority. That will be a chance for getting the brain damage. So next one. So the correct placement for the oxygen mask placement for the neonate, that is entirely covering of the nose and mouth, including the jaw area. So that will be the correct position. We should not cover that below that nose, or that only that mouth, or over the eyes. We should not cover any of this. So correctly we need to cover the nose and as well the mouth. That will be the appropriate position. So next one. So what is the cervical dilatation indicated that the patient need to transfer to the labor room? The correct answer will be, so whenever that mother is getting dilation over that 3 to 4 centimeter, that will be considered as active phase of second stage of labor. So immediately we can transfer the mother to the labor room for delivery. And the next question. So another name of umbilical cord, that is a novel string, birth cord, or funiculus umbilicus. 87, related to the ventricular associated pneumonia bundle, care included all. The exact answer they asked. So there are the commonly, so for bundle care will be provided. There is the elevation of the head of the bed to the 30 to 45 degree and daily sedation, vacation, and daily assessment of the readiness of extubation, and third one peptic ulcer disease or prophylaxis, and the fourth one deep venous thrombosis prophylaxis. So among this, the hand washing will not be considered as the bundle care. So that's all about the shift 1 question. So there will be some corrections with this question and answer. If you know any corrections, you can write it in the comment box. And if you know any further answers and questions, that also can be written in the comment box. We'll see in the